pathology, oncogenes, and tumor suppressor genes. All right, so for these, once again, as I said a million times throughout this pathology playlist, you have to understand that you're going to be going through every single system in the body. And believe it or not, you're going to get to know these really, really well. But right now, it might be daunting to learn all of them. So I will say, as I did, I went through all of the other systems before I went back to these pages and actually fully understood the oncogenes and tumor suppressor genes, okay? For your Heme Onc course coming up, you're going to have to know a couple of them. So I'll kind of point them out as we go through. But I'm going to talk through these because I think it's really important. They do like to talk about them a lot through the other systems, but I'm not going to go too much in depth. Now, real quick, what's the difference? Oncogenes versus tumor suppressor genes. Oncogenes are gain-of-function genes, okay? So that means that if I were to have a gene, okay, I feel like the best example that I could provide is BCL2, okay? BCL2 is a gene that normally inhibits apoptosis, okay? Now, if that gene is transferred, okay, so it's translocated and it switches with another gene that is normally continuously activated, then it becomes an oncogene because we normally don't have a consistently activated BCL2 because that means that we would have no apoptosis ever. But when it translocates, it's called a gain-of-function mutation. And that's what all these oncogenes are. These are gain-of-function mutations. They originally are fine in our system, okay? In our chromosomes and our genes, they're fine. But right when they get that gain-of-function to be constitutively activated or completely inhibited, then it leads to that oncogene function. It's called gain-of-function, okay? So they're usually fine, but right when they're constitutively activated via some type of mechanism, they get that gain-of-function mutation and they go crazy, okay? And they favor tumorigenesis. Now, what do we care about? There's a lot here that we care about and that we need to understand, but I'm just going to focus on just a couple that you need to know as of right now. One, the RET mutations. MEN2A and 2B, which you probably know nothing about, is going to be important to know that RET, MEN2A and 2B only are oncogenic genes, okay? Don't worry about it right now, but you're going to be seeing it later on. BCR-ABL, we talked about it in the hematology oncology section, that's in the CML, that is an oncogene, okay? JAK2, BRAF, c-KIT, but KRAS is another important one that you're going to see for hematology oncology that they care about, as well as BCL2, okay? We already talked to BCL2. It's seen in follicular, right, and diffuse large B-cell lymphomas, so understand BCL2 is an oncogene. What I will say right now, for your help, just for hematology oncology, you need to know these. You need to know that BCR-ABL, JAK2, and BCL2 are the three things that you need to know are oncogenes just for this FPD course coming up, or for your hematology oncology course coming up in the summer. Okay? The rest, you're going to have to know, but don't worry, it's going to be way less daunting when you actually learn everything else. Next is tumor suppressor genes. So just how oncogenes are gain-of-function genes, tumor suppressor genes are the opposite. These are loss-of-function genes. These are usually anti-tumor, right? But then right when we lose that gene, we get an increased risk of having that cancer, okay? Now, what do you need to know? First one is APC. APC usually is associated with colorectal cancer with FAP, okay? FAP, okay? Now, you have to know that association, and you have to know that APC is a tumor suppressor gene. Next are the BRCAs, BRCA1 and BRCA2. Those are associated with the breast cancers as well as ovarian, prostate, and pancreatic, but those are tumor suppressor genes you must know. Next is MEN1. That's going to be seen in our endocrine system, okay? That's tumor suppressor genes, and it's weird because MEN2A and 2B are RET, and those are oncogenes, okay? But MEN1 is tumor suppressor. NF1, NF2, very important. RB, very important. Retinoblastoma inhibits E2F, okay? And you're going to see it associated with retinoblastoma as well as some types of bone cancer like osteosarcoma, okay? The highest yield one is TP53. This is a tumor suppressor gene. We know that P53 is needed in order to check. It's a very, very important cancer marker, okay? It checks if there's any mutations. So if we lose that TP53 under loss of function for tumor suppressor genes, right, we can lead to a lot of cancers. So many cancers, most cancers are due to this, as well as Laframini syndrome can be due to this, okay? And then the last two ones I will talk about is VHL, which is von Hippel-Lindau disease, as well as WT1, which is Wilms tumor. Now for this course, the hematology oncology course, once again, you need to know these. APC for FAP, colorectal cancer, as well as TP53 for our P53, most cancers in Laframini, as well as RB1 for retinoblastoma osteosarcoma, which inhibits ETF. Okay, so understand those processes. Those are the important ones, and we'll talk about it specifically. Now, you might be wondering later on, Nate, how did you remember these? How did you tell the difference? This is what I did. I went online and I looked up Dirty Medicine. Dirty Medicine has videos online, excellent videos, okay? And they have songs, which is weird, but they have songs about autosomal dominant, autosomal recessive, and X-linked recessive diseases. Now, those in and of themselves are important to help you memorize which ones are which, because there's bound to be at least one question on the exam asking what type of inheritance pattern it is. But also a weird thing about it is that we have the autosomal dominant video has pretty much majority all of the tumor suppressor genes in it. It was something that I found, I figured out on my own. But if you remember the autosomal dominant Dirty Medicine video, pretty much all the important ones are tumor suppressor genes, okay? So take a look at that later on. I mean, it's not really important for the hematology oncology section, but once you need to know that, it's gonna be really, really important. Okay.